I am waiting on YouTube to go live. There we go. So I am live on YouTube, guys. For YouTube, I am sorry. My camera is terrible on a gaming laptop. The quality sucks, but the content will still be here. You can also view it on Instagram. I have it on my Instagram, and I posted it. It's Misty Huffman 79 if you guys want to reach out. I may or may not have my Facebook profile back tomorrow, so we will see. I usually do all my live videos from there and then just upload them to YouTube. But I have a lot of my El Pasoans following me now. I drive Uber in my spare time for something to do, and I had a lady recognize me last night just from my picture, and I'm a respiratory therapist. So she said she had shared it and thanked me for speaking up. So, and Instagrammers, I will definitely pay attention to the question button this time. I didn't realize until after the video that there was the question button. So that's great. I wish I could turn this on silence so we don't get interrupted. But I know there's a lot of questions out there. We're seeing huge numbers, and it's kind of scaring people. There's the talk of the 2 vaccines, so I do want to touch upon those and what the similarities are between them, and also touch upon some of the 5G claims that we're hearing with these vaccines. So I have a lot of information to share tonight. Quite a bit of research I've done trying to figure out exactly where I want to start. A lot of people have been sending me messages. The one of them was an article. It's titled "The Horror of El Paso's Latest COVID Surge," and it's on slate.com. I definitely wanted to touch upon them because there is a lot of important information in there. Trying to think where I wrote this down at, but there's also a lot of claims that need to be addressed. She says that the death toll is at 23 a day, and that is a high number, but remember, people got infected all at one time, so we are going to have a lot of deaths at one time. A lady reached out to me today. One of the news ladies who interviewed me had sent me a message, and this woman had seen one of my interviews and had reached out, and her question was, her mom's been on the ventilator for like 35 days, and the doctors were giving her, they wanted her to make a choice on whether or not she wanted to remove her from life support or not. And my landlord's mother was in a similar situation, but she was only on the vent for like 16 days, but they had called her and told her to prepare for the worst, and they were expecting, her to pass. And a few days later, she was off the ventilator. We deal with a lot of inflammation in the brain. Like I said, all of our patients who wake up are very confused, even if they're off sedation. The respiratory center is in the brainstem. So if you have a lot of swelling, they're going to get agitated. A lot of times they breathe really quickly, and we have to sedate them again. We even had to use paralytics on some of these people because their pressures were peaking so high. So I gave her the advice to hold out and wait. If everything else was stable, she's not in cardiac arrest, they're not seeing organ damage, she doesn't have pulmonary embolisms, give her a chance. 3 to 6 weeks is what I see people on the ventilator for. So this is a lengthy virus. I would hope that doctors are not trying to encourage families to pull people off a ventilator just to make room, because that's not ethical and highly unethical. But I did give her the advice to allow her to fight. 35 days is honestly, average. It's not unheard of, and these doctors do need to understand that these patients are on the vent a long time. This is not what we normally see. It took a while to get used to all these differences, but when you start seeing multiple patients like this, it begins to click, and you begin to ask questions and do the research like I've been doing. She did say that the government is stripping away the local authorities' power. We didn't follow the governor's mandates here. It was enforced for a few days, but everything was let to be lax. I mean, there was parties going on, there was large gatherings, which I'm assuming is what happened. There was some big event in El Paso. I haven't researched to figure out when the spike started. Those are questions I do have, but there had to have been some kind of event where everybody was in close contact and it spread like wildfire. But the state doesn't want things shut down. We don't want things shut down, folks. China had a total of 5,000 deaths. The place where this started, 5,000 deaths. Everything has returned to normal over there. They're having concerts, and it's because people mask, they social distance. They follow, they really have a choice in China, but this is what happens when you follow the guidelines. You get back to normal life, but we are fighting and arguing so much over this piece of fabric that if these cases continue to rise, one of three things is going to happen. Mark my words. And this came from Dr. Mike Hansen. He's a pulmonologist. A federal mask mandate. We should not have to be a police state to be told to wear a mask. Folks, please, come on. If we can slow the spread and decrease the risk to the public, why would you not want to do that? Quit arguing at this point in time, because life is about to get really bad. If that doesn't happen, then a full government, just everything's going to be shut down, because we can't continue to spread like this. Or we're going to have millions of deaths because nobody wants to listen and we just let it go. So those are our three options. So I think the least invasive and risky would be to wear that mask. But if we would have followed the governor's guidelines from the beginning, we wouldn't be in this mess right now. Let's see here. She's calling us unwitting guinea pigs for immunity. First of all, you can't achieve herd immunity without a damn vaccine. It's never been done. If we do it, we'll make history. So there's that. Also, 90% of cases in here have been Latino. Again, Luana is getting on NPR and Newsweek and making claims of racial inequalities here, but I don't think that's coming from the hospital. I think it's coming from staff who don't want to do their job, kind of like the ones that we get from Luana's company. That's not a facility issue. That's a personal problem. And that individual, if that's what they're seeing, Luana, you're responsible to report that to administration. And you should, because that's not how we treat our patients. It's definitely not happening here. If we have somebody's relative in the hospital, we don't give them preferential treatment and medications that aren't given to other people. They're still followed by a doctor, and that doctor is not going to be told what decisions he can or can't make for a patient's care. We don't just offer things to relatives. I've been a patient in my hospital and many hospitals anytime. I don't get any preferential treatment, not at all. But what's happened is this has become a political issue. So us frontline workers, people are turning to us for advice and for facts. And that's what I have a problem with Luana, because she has spread fear, not facts. There's a way to handle things and there's a way not to do it. And getting on a Facebook post and making an emotional response like that is definitely not the way to handle it. So that's where my problem lies. Now, I know our numbers look big, not only in the state of Texas, because we've surpassed 1 million cases, but we have 28 million people here, folks. That's like the size of Thailand or Taiwan. That's just a country. So, of course, when we, have more population and more land mass, we're going to have a higher case count. But when you do the percentages compared to other states, it's not as bad as it looks. The deaths, the top 10, we're not even in the top 10 highest states for deaths, folks. So please simmer down. The highest per capita, number 1, North Dakota, South Dakota, Iowa, Wisconsin, Utah, Nebraska, Tennessee, Indiana, Illinois, and Mississippi. Texas isn't even there. So please calm down. Please. I know the numbers look bad. It's shut the media off. If you have questions, come to me. I am more than happy to answer them. I answer them morning, noon, and night, and you can ask all of my followers. I do it because people are scared, and I don't want you in fear. Hey, April. Let me check here. Okay. I had so many questions last time and I missed them all. Madeline made it. Listen, Linda, listen. So the new cases, and here's another thing, folks, you know, I know the president has gotten on the television and has made some statements like the doctors are being paid more money, which is not true. The hospital is being paid more money, but that doesn't mean the doctors are getting more money in their pocket. Their paycheck is still very much the same. But the new cases in the United States have increased by 18%. However, testing has only increased by 4%. So all these high cases that we're seeing is not due to increase in testing. They're not rising together. So we can't base it on that, even if the president says that's what's going on. That's not true. What we want is the positivity rate at or below 5% for 14 days before reopening the cities that have been closed down. Currently, I think El Paso is like 13%, but like a rolling average. It was at 23. It's dropped a little bit. But the doctors are not inflating the numbers. You know, we know when a patient comes in, if they have COVID then and they pass away, then it's a COVID related. The question is, did the COVID contribute to the, you know, an accelerated cause of death? And generally that's yes. There's some people who get it who are already in a very compromised or terminal state who are going to pass, but we don't know when. COVID will definitely accelerate that. With the questions with the vaccines, the mRNA vaccines, there's two. There's the Moderna and then there's the Pfizer. So with the Pfizer one, with the storage at 25 degrees Fahrenheit, which is just below freezing, it can keep for 5 days versus the Moderna can last for up to 1 month. Now, if you can get the Pfizer vaccine down to negative 94 degrees, it can last for 6 months, but it's really hard to get storage freezers like that. These are just preliminary results with Pfizer. They're not peer reviewed and they really haven't released too much data on it like Moderna did. But they had 0 severe cases in their placebo group and in the control group who got the vaccine. With Pfizer, you get the injection on day 1 and then on day 22. However, with the Pfizer vaccine at day 22, the people who had symptoms had them about 7 days after the last injection. With Moderna, they get it on day 1 and day 29, and the people who showed the most symptoms was 14 days after the last injection. The Moderna data, it's not published or peer reviewed. It's got 94.5% effectiveness versus the Pfizer is 90. What was really cool about Moderna is they gave a breakdown. Both trials made sure to include racial diversity because we know Hispanics and Blacks are more prone to complications with this. So they got 30,000 people. They stopped the study to do an interim analysis at 95 people. Once 95 people got infected with COVID, they stopped the study and took a look at the data. So they unblinded everything and they found that of the 95 people who got sick, 90 of them had the placebo. So it wasn't the vaccine. It was just whatever they had injected. 5 who got sick actually got the vaccine, but they only had mild symptoms. So that definitely is promising. So it appears to prevent severe COVID infection and complications. The question we cannot answer currently is, will it stop the viral replication? Does it sterilize the virus so we don't pass it on? Or does it just protect you? So we don't have answers to that question right now for either vaccine. So that's going to take some time. The way it works is that this is a special vaccine. This is one of a kind. This has never been done before, which is why I'm kind of on edge. I want to see more data about the side effects and whatnot before I personally get it. But there are people who want to be protected and they don't care, and that is fine. My job is to give you informed information so that way you can make a better decision for what's right for you. There's nothing about RLF 100. I have talked and talked and talked about it, and apparently nobody wants to listen. Kind of like the beginning of all this. A vaccine does is it's injected into the body and it merges with specific cells. Messenger RNA is released into the cell cytoplasm, so not the nucleus. There is a rumor going around about 5G, and let's see here. What did this crazy Dr. Northrop say? Claims mRNA will alter human DNA. However, you need to get it into the nucleus to do that, and it lives in the cytoplasm. And while it's in the cytoplasm, it interacts with the ribosomes, and the mRNA will be translated into proteins. So it kind of tricks the body to create these proteins that cause an immune response, and your body will begin to produce its own antibodies against against COVID. So we don't have to inject a dead virus into you in order to get the protection. It's changing the code to the RNA. It is not going to change your body's DNA. No, not at all. So these proteins are immunogenic, which means they are substances that provoke an immune response. This will cause antibodies to form along with other immunogenic responses, such as a T cell response by memory. Your body has a couple different types of immune systems. So that's what these vaccines are about. It's up to you on what's right for you and your family to get it. Trying to think if there's anything else. I do want to touch on the more 5G stuff. This doctor also claimed that new DNA will cause, well, she said chimeras apparently, but it'd be chimera to form, which is human and animal combination DNA. Our DNA is already somewhat chimeric through evolution and contact, and this lady is an obstetrician, and why she's talking about the immune system is beyond me. We have a lot of this with these doctors that come out with these wacky claims, and then it's got nothing to do with their normal practice. She also says that metals and toxins will create a human antenna. So if there are any metals or whatever in the vaccines, they're very minuscule, and they're definitely not going to create a 5G human antenna. No. Also, Bill and Melinda Gates have a patent for, let's see, it's a nanoparticles in vaccine will link them to cryptocurrency. The patent is actually for like the Fitbit, so it's like a reward system. They'll pay you in cryptocurrency for staying healthy, like completing so many steps per day and stuff like that. That's what the patent's for. People, stop. And also she's claiming that luciferase that MIT developed in conjunction with the measles vaccine, it is a way to like scan to make sure that you've had it, but it's in no way linked with COVID, and it's not, there's nothing for that yet. So that's like the Dr. Northrop claims that you're going to be seeing, because it's spreading all over the place, and hopefully they censor her instead of the people out here spreading facts. She's got fears. I don't need none of that. We got enough of that going on. So let's see here. Talked about all of that. Talked about the vaccine. Okay. So the next thing, Dr. Hansen, I did pin this video into the coronavirus playlist, but this is really important. And I have been talking about these numbers, and you guys from Facebook will remember all these terms that I talked about months ago, probably back in May. So I've been talking about this for 6 months. And finally, and I'm still seeing doctors not doing these panels. So I need you to listen to me. We need these blood panels done, and you need to look at these numbers because that is the best predictor that we have as to who's going to be most affected, and they meet the criteria for the COVID cytokine storm. So this came from researchers at Temple University in Philadelphia, Maryland. You'll be happy, another Pennsylvania reference. Just checking for questions here. Sorry, guys. Yes, it is Madeline. Christine Northrup. It is. That's exactly who it is. Z-Dog just did a video debunking all her claims, which is what I just watched and got the information from because Z-Dog is the shiznit. But this came from Dr. Hansen, so this is great because now I have something to shove at the doctors. They've come up with a statistical model to determine who's most at risk for the cytokine storm with COVID, because once we reach that, that's when we have the biggest problem. Less than 15% of people have severe disease symptoms to the point of requiring hospitalization. Less than 5% require ICU, but as you can see across the country, the ones that do require the ICU, they become residents for a long time. I'm going to get to know these people quite well because they're going to be with us for a while. But we know that the biggest risk factors are older age, usually above 65. Males are more affected, smokers, type A blood, and comorbidities like hypertension and diabetes. But what we need ran are the CBC and CMP panels. The CBC is the complete blood count, the CMP is the metabolic panel. But ferritin, CRP, LDH, D-dimer, and troponins, we need those ran. I don't know how many charts I get into, and these people have got nothing ran. Nothing. Like I have no base, no nothing. So these doctors are not staying up to date with some of their information, and they're getting mad at some of their people who know a little bit more. I need you to listen. Listen, Linda, listen. Run these because this is your biggest indicator of who is going to go into a cytokine storm. What they've found that most of these people met the criteria at the time of admission or shortly after. So that's why it's important to do this right away, not at the end, not 5 days later. I need these ran in the emergency room when these people come in. Run it. That way we have a trend because there are 6 criteria to meet. And some of this is going to go over some people's head, but my medical professionals out there, I need you to listen. Inflammation seen on the chest x-rays or CT scans. It's what we see with the ground glass infiltrates. Number 2, a ferritin level greater than 250. Number 3, a C-reactive protein greater than 4.6. Number 4, it's albumin less than 2.87, or the lymphocytes below 10.2%, or the neutrophil count greater than 11. So any one of those 3. Number 5 has got a longer list, but this is all inflammatory and clotting markers and stress. The ALT greater than 60 or the AST greater than 87. Or you can use the D-dimer greater than 4930, which is pretty damn high. That's your clotting. When you see that, you're like, oh crap, these people are at risk for a PE and all sorts of other things. The LDH greater than 416 or troponins greater than 1.09. And last but not least, the anion gap less than 7, chloride greater than 106, potassium greater than 4.9, or the BUN greater than 29. This has a specificity of 79% and a sensitivity of 85%. We know, and I have been talking about this from the get-go because I stayed on top of the education, that these markers, I don't care if you have a positive or negative COVID test. If you have all of these going on, you got freaking COVID. So this is a great way for a doctor to correlate to a test, even if it's a false positive or negative. If we're looking at these numbers completely out of range, we only see this with COVID patients. So it is something that you can do if you are sitting there waiting for a test. You can look at these numbers and go, hey, there's a high probability that this person has COVID and we're not doing good if any of these numbers are out of whack like this, because you're going into the cytokine storm. The problem, so the overall case fatality rate is 0.5 to 1%. However, this only indicates the mortality rate of documented cases. There are so many people out there, asymptomatic or mild, that we don't know. So we can't give you the infection fatality rate because we don't know who's all been infected. We're going to have to wait until this hell has subsided and do what Spain did and do a widespread study and see statistically what we can guess as to what our infection fatality rate is. So these are really important numbers. So the average length of stay for a person who met this criteria, and this is not even on a ventilator. This is just going into the cytokine storm, which usually leads to the ventilator. But the average length of stay is 15 days if the criteria are all met, versus 6 days if they're not on that list. The mortality rate was 28.8% versus 6%. So they have a 4 times higher likelihood of dying if you meet the criteria in that list. We could have been talking about this months ago. I don't know why the information is slow to spread through the medical community or why some of these doctors aren't staying on top of the education, but this is really important information. Hansen at Temple. I don't know if he's at Temple. He shared their video or the study from Temple University, but he's a great guy. I mean, he's got a lot of great videos, and Z-Dog and the guy from MedCram also recommend him. Yeah, definitely track those down for me. Oh, got a question. I see it. No sound. Oh, crap. I wonder if it's because the microphone. Can you hear me now? I don't know if it's because of the microphone. Possibly was covered up. I don't know. Let me try moving the phone here. I don't have anything. Yeah, I do. Let me see if I can set it up in here. I don't know if it'll slide around. Darn it. I hope to God that stays. That was a lot of information. Shoot. I hate technology. Cytokine, CYTOKINE. So this is all really important. We need to look at these numbers because it's a best predictor we have of who's going to pass away from this. It was the Instagram one that was having problems with sound. If you guys can hear me, let me know on the Instagram side, because I don't see anything else for sound. I picked it up off of the, hopefully it's not muffled. Okay, so the monoclonal antibodies, the bamlanivimab, these are all names that we can never, this is the B word. So Eli Lilly found that it decreased the risk of hospitalizations and eased the symptoms. We don't have any data to analyze, so it's not been peer reviewed yet. They found that less than 2% of people had symptoms progress to required hospitalizations versus 6% in the placebo. So that is statistically significant. But we need to remember what recovery means for some people. We're not tracking the long haulers who have complications, who are on oxygen still, who have tracheostomies, vent dependency. So there's a lot of long-term effects that we are not tracking, and we honestly should have been from the get-go. With the monoclonal, they found 4% versus 15% in those higher categories. Oh, the ones who are in the high risk categories, like the over 65, the male with the comorbidities, in the placebo group, it was 4% versus 15% in that group. So that's also very significant for that older group. However, it's really important. This monoclonal treatment is to be given prior to getting severe symptoms. So when you get sick, this is why I have a problem with somebody getting on Facebook and having an emotional meltdown over the trauma that we're experiencing out here, because it prevents people from seeking treatment early on. And we are getting ready to get these monoclonal antibodies. And it's proven with science that if you get them early on, you are not going to progress into severe symptoms. Less than 2% of people progress into severe symptoms if they get the antibodies in time. So that's why it's important to get to the hospital early. Don't wait it out. Don't try to tough it out. That's when we can't help you right now. There was a recent study, and I want to touch upon this, and I'm going to put a huge disclaimer right now. Talk to your doctor before taking anything, okay? But they have found in a recent study people on low-dose aspirin prior to getting infected, so they were on it regularly. It's associated with a decrease in mechanical ventilation need, ICU admissions, and in-hospital mortality. Now, they're doing further investigation in this. It's the low-dose 81 milligram baby aspirin. However, it can cause bleeding issues, so you can't just go take it without consulting your doctor. Consult your doctor. I'm not a doctor. I'm giving you data from the journals of medicine and the New England Journal of Medicine, the very boring stuff that nobody wants to read through, and I'm regurgitating it to you. Talk to your doctor. I cannot stress that enough. Also, vitamin D. Now is not a time to be deficient on vitamin D. We know that vitamin D plays a role with COVID. So stay on top of your vitamin D. And it's a fat-soluble vitamins K, A, D, and E. 4 fat-soluble vitamins. You need to eat some fat with it, or it's not going to digest and bind properly. So fat-soluble, eat some fattening food with it, but take your vitamin D. We know it helps. What we know right now with the antibodies is it appears to protect you for about 5 months. That is increased from the 3 months that we found a few months back. So we are still finding people have antibodies. There are some people reinfected. We had a reinfection here in El Paso, but that's kind of like an exception to the rule. It's not the rule that you can get reinfected, period. Always stay safe because you're protecting yourself from other things too. But we do know that it's going to last for about 5 months. Now this and the Regeneron monoclonal antibodies, that's what Trump got. And I heard it start with an R, but I couldn't hear what he had called it. But it's the Regeneron. It's REGN-CoV2 is what they're calling theirs. But that's what he got. He got it early on when he got sick. He didn't get anything miraculous. He didn't get some special drug. He just got the monoclonal, which is an isolated antibody that we know is most effective with COVID. Okay, good deal. So we have the vaccines, we have the antibodies. So those are choices. You know, there's some people who, you know, it's against their religion to receive blood products. So if they get sick, the monoclonal antibodies aren't going to be for you. So we need to think about these things because everybody has a different value system. They have different beliefs. And we as healthcare professionals respect your choice. I don't want to hear of any doctors forcing you to make a decision to take your loved one off of a ventilator because they need the room. No, we need to allow these people time for this inflammation. The brain is really affected with this. People are coming out of this with severe depression, bad memory, brain fog. they're experiencing a lot of side effects. And your respiratory center that controls your breathing is in your brainstem right here. So if it's inflamed, it could explain some of the crazy breathing patterns that we're seeing and having to sedate the living daylights out of people. It takes time to get through that. We need to give the body time. There is no special aggressive treatment, Luana, that we can do other than give somebody time. I'm not going to force medication on somebody that could be harmful. Like I said, the remdesivir has been shown not to work. And we've known from the very beginning that it can cause kidney problems, and it did, and it does. So that's just not stuff that we can really give. I'm trying to take a look at this article and see if there's anything else I wanted to address. That was Governor Abbott, business community. One of the questions that was posed to her, I'm wondering if with hospital capacity getting swamped the way it is now, you're seeing doctors, hospitals, CEOs start to speak out in ways you wouldn't usually. And she says, I think one of the things that's become clear is the public's not listening to politicians because they don't trust them, which is very true. Look at the mess we're in. And people are really looking to healthcare workers, particularly us frontline workers and nurses, to tell them what's going on. That's why it's important for us not to get out here and have this emotional spastic reaction, because the public is looking to us for information. She has a platform and she's acting like Nurse Ratched, posting her bank account of $18,000 and talking about buying her new furniture and pictures of crab legs and promoting her business. So she's using this to profit in other ways. I'm doing this to provide education to you because it's very important, because you are looking to us frontline workers to be honest and tell you the truth about what we're seeing, what we know. And I take a great deal of pride in that, because that's part of what we represent, and it's in our job description. It's well within our scope of practice. And I know we have the holidays coming up, and I know everybody is getting shut down. I'm getting messages left and right that multiple people are infected that they know that are around them. We still need to communicate with our families and touch base. The holidays are a high time for depression, suicides, heart attacks. Man, I can't believe how many heart attacks I would have on Christmas and Thanksgiving Day when I worked in the ER. It was crazy. But these times are very stressful, so we need to check in on our loved ones. Do a virtual Thanksgiving. Put everybody together on Zoom. Still try to do things that include each other. Do a family game. I mean, there is game options in these rooms. You can utilize the Facebook room. Be a persistent pain in the butt to your family, because we are not meant to live isolated like this. People are dealing with a lot of depression and anxiety because of this. So we really need to go out of our way to be innovative right now, still stay in touch with our families and communicate if it's safe. If you can do it outdoors, all the better. You can still be around your family, just socially distance. You don't need to avoid each other at all costs. I don't want people doing that. What I want you to do is interact in a safe manner, because number one, people learn by example. So if you set a positive example and you keep your distance and you still maintain your life and live a normal life, then you're doing it right. We do not need to live in fear. You can be around your family and friends, and you just need to be responsible. Socially distance, keep the 6 to 10 feet apart. If you live in an area where it's warm outside, or you can do like an outdoor tent and put some heaters out there, do it. Be different, but don't avoid your family. But don't put everybody in a crowded ass basement or room with no ventilation, because then you're asking for trouble. If you can't do it responsibly, don't do it, and choose some alternative ways. Another thing, last I want to touch upon, I was interviewed again by one of the ladies who had interviewed me in response to Luana, but she sent me a freaking group that was or an event that was created by one of our local bars, and it was like a sexy frontline worker, a COVID party, like come get COVID and get sick and just get it over with. Hello, if we get sick, who is going to take care of the patients here? What? Not only is COVID not sexy in our 3 layers of PPE and our face shields and our respirators and everything else and our sweat, but you want us to come spread COVID? How about some social responsibility? Oh, locos. I am really disgusted with that. A lot of us are. There was a lot of response to that. So no COVID parties. No, bad idea. Bad, bad, bad. Let me see here. Let me check my messages now. I told my elderly friend she needs to go to the hospital because now she's wheezing and she has blood in her mucus and she didn't see the doctor but talked to Dr. Yeah, she needs to go to the hospital. Blood in the mucus is never good. Either you're coughing too hard and you've hemorrhaged your alveoli, or you could have TB. But her ass needs to go to the hospital, and unless they're giving her dexamethasone, steroid isn't going to friggin' help them. We're not seeing help with prednisone. It needs to be Decadron, and it's dirt cheap. So there's no reason that we're not using that steroid. We know it works. There's a hell of an increase. A lot of stupid friends out there from people who are just avoiding going to the hospital at all costs. It's absolutely ridiculous. Please go. We're not trying to kill you there. But if your doctor is not making wise choices and he's telling you to do things like that, I'm sorry, that's not okay. Yeah, a PTSD kicking in. Yeah, this is not a good time. I really hope I get my Facebook account back tomorrow so I can reach my veteran page. But I'm here for questions. Hopefully once I get my Facebook account back up, you guys can all follow me over there when I do my lives. We'll find out tomorrow night whether or not I get it back, but you are more than welcome to send me a friend request. I did start a Facebook group. It's called El Paso COVID Q&A. Feel free to join, ask questions. I encourage it. I want people in my community to ask questions because that's what we're here for as healthcare providers. And I am trying to offer you a platform. Even if you're not in El Paso, you are more than welcome to join and ask questions. I just labeled it El Paso because we are here. We are an epicenter right now, and it's easy to find. So you can find it. I shared it to my undercover Facebook page. But if you have any questions, just shoot me a message or anything. I am always available to answer questions. So I'm gonna make sure I've got everybody here, and then I will wrap it up. Okay. Just said she will go if it don't help. Let her know that there's not much we can do if it gets worse. So she's really going to screw herself and wish she would have listened sooner. I would explain that to her, that we can't help you once it gets worse. Now is the time. Like she would, if she's positive, monoclonal antibodies right now would be a great thing for her. So please, 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 please don't take bad advice from friends. Ask the health professionals, and we are more than happy to answer. We would rather you ask us than avoid going to the hospital. All right, guys.